Despite high hopes and ambitious goals, most vaccination campaigns across Europe have started off rather slowly due to limited stocks of doses and logistical constraints. The COVID-19 outbreak has once again gripped parts of Europe, with new virus variants emerging from the UK and other parts. Rates of vaccination witnessing wide disparity among the countries across Europe. Lack of availability of doses, storage of jabs, the long wait for vaccines approval, all of these have been aggravating the worsening virus crisis across the continent. Countries like Germany and Finland, that had a relatively good record when it comes to managing infections and limiting the mortality last year, are now way behind Israel and the UK in the vaccine rollout drive. The UK is currently leading the race with 3 vaccines approved by its drug regulators, Pfizer, AstraZeneca and Moderna. Authorities have administered nearly 2.6 million doses to its people. Meanwhile, countries like France, Belgium and the Netherlands have inoculated a small number of its population so far. France's health minister said earlier this week that more than 50,000 doses of the vaccine from US-based Moderna would be ready for use this week in the hard-hit regions. The Netherlands Prime Minister Mark Rutte announced on Tuesday that the government is extending its COVID-19 lockdown by 3 weeks to the 9th of February to contain the spread of the new UK virus variant. Russia was first out of the gate in August, embarking on a mass program with Sputnik V, the country's homegrown vaccine. As of this week, over 1 million Russians have been vaccinated. That's a small fraction of the country's population of some 145 million. UK, remember, was the first country in the world to approve the Pfizer-BioNTech vaccine for emergency use. Britain launched a widespread campaign with their first approved vaccine on the 8th of December last year. The 27-member European Union launched its much-awaited vaccination drive with Pfizer vaccine on the 27th of December, setting out a coordinated program to ensure fair access to doses. EU regulators say the AstraZeneca jab could be approved by the 29th of January. On the 6th of January, the bloc bolstered its arsenal by approving Moderna's coronavirus vaccine. Still, the rates of vaccination differ widely across the continent. Lucy Hof joins us from Brussels for more on that. Hi, Lucy. There has been a lot of talk about the criticism that has come the EU's way for the slow approval of these vaccines. But it seems that even with the approval, a lot of hiccups still remain.
That's right. I mean, what the EU tried to do in June when it was starting to work on its vaccine procurement strategy is place procurement bids with around 7 vaccine companies of a total of 160 that were due to be on the market at that time. It then invested in as many as 2 billion doses from all of those 7 companies. But of course, at this stage, only 2 of those vaccines are available, and there has been strong criticism for the European Commission at its vaccine procurement strategy, with people saying there hasn't been enough orders of the vaccines that were more likely to be available in the short term, particularly the Pfizer-BioNTech shot and the Moderna shot, which has also now been authorised, although of course we may also have the Oxford AstraZeneca vaccine by the end of this month. That there aren't enough shots authorised in order to go round the European Union, all EU 27 member states. And there have been hiccups, as you say. We know that there are logistical challenges in dealing with the Pfizer-BioNTech shot, that storage temperature of -70 and the delicacy of handling the vaccine that means there's been some logistical problems getting it out to citizens as well as countries dealing with a high level of vaccine scepticism, as well as a slow rollout, particularly in contrast with other countries such as the UK and Israel.
And then again, there is that constant fear of the mutation of the virus. Give us a better sense of how the authorities have been trying to ensure that the measures that have been put in place are tightened.
This is really coming down to border restrictions at this point. Here in Belgium, there has been really tightened up border measures, insisting that anyone coming from the UK has to have a PCR test taken 72 hours before entry, and then again twice upon entry into the country. There are more stringent police checks at the borders and more monitoring of people who've travelled in from danger zones. But we have had a number of cases of this new UK variant reported on the continent, and certainly there are strong efforts to try and contain that variant as well. But of course we have also had reports of other new highly infectious contagious variants on the continent as well. And also of course there is monitoring of the variant that's coming in from South Africa too. So for the moment this is about preventing this variant from entering the EU and starting to spread in earnest in the way that it has been spreading in the UK, which is now by far and away Europe's worst affected region, with really appalling rates in some parts of particularly London, with as many as 1 in 15 people infected in the capital at the moment. So certainly there are more stringent border checks and trying to prevent that variant making its way into the EU 27.
All right, Lucy Hope, thanks very much for joining us with those details. WION now available in your country. Download the app now. Get all the news on the move.